so instantly, drugs. Not a medicine, rather a drug. That's a drug because it causes addiction.
Drugs, clearly.
And that really pisses me off so much, and I just want to put an end to it. And that's why we're doing this with the company, that's why we're doing this with the campaign.
We still need to do a bit more educational work here regarding the topic of cannabis.
In my experience, cannabis definitely helps me the most.
We want to become the gold standard in quality, and we have achieved this.
The gold standard, as they call it, really is like that. Everything is sterile, everything is clean, processing method that is very gentle on the flowers.
Everyone has to decide for themselves what to make of it. Take the medical route or knock myself out in such a way that I can't manage anything. You can do both, but it's just cannabis. So it really was a bit like that. We already had a pretty successful entrepreneurial career and were a bit bored or just wanted new challenges. And then we sat together at a poker game and talked about different markets and sectors. Then one of us came up with the idea of making cannabis, because there was a change in the law.
Ärzte können schwerkranken Patienten künftig auch Cannabis als Schmerzmittel verschreiben. Der Bundestag beschloss dazu heute einstimmig einen entsprechenden Gesetzentwurf. Demnach können bestimmte Patienten Arzneimittel mit der Droge künftig in der Apotheke erhalten, ganz legal und auf Rezept. So soll auch die Palliativversorgung verbessert werden.
And we were actually at the notary the next day, founded the company, and then really set ourselves the task of really getting cannabis out of this drawer. Because for several years, or even decades, it has been vilified as the worst drug in the world. Everyone who hears about cannabis goes crazy.
So like directly drugs?
Not a medicine, more like a drug.
It's a drug because it's addictive.
Drugs, clearly.
We simply want to show the world that if you use it medically, in a medical context, it can really be an incredible enrichment for life without a lot of harmful side effects that I might have with other preparations.
And with cannabis, it's just that I can tolerate it much, much better.
Cannabis is an entry pressure to get off this mantra. It needs education. So every time we invite various associations, clubs, or people to the company, for example, to simply show them how we work and how cannabis is produced, most of them come in with a completely different idea. So they really think that somehow, I don't know, we're sitting here in the basement, we've got some kind of dim lights on and some weird dude comes out of the corner and somehow shovels cannabis around. And they're always amazed when they actually come in. Everything is sterile, everything is clean. We work here with face masks, hairnets, exhaust air systems, GMP, and I don't know what else. And if you then show them a real-life example where it has really helped people to the extreme, then they simply leave here with a completely different perspective.
Can I actually really live my everyday life truly normally, as I would if I weren't actually sick?
Significantly much more quality of life for now.
We can say with absolute certainty that these are the medications that relieve the pain the most.
And with cannabis, it's just that I can tolerate it much, much better.
That's exactly what we want to represent through our work. It's a wonderful plant, a wonderful medicine, and if you use it well, it's just fine. And the world should know.
I'm Thorsten Greif, one of the co-founders and one of the 2 managing directors of 420 Pharma GmbH. We really started out back then. We looked at what was on the market and it was really average quality. And since we've been in the game a little longer, we said we wanted to become the gold standard in terms of quality. And we have achieved that. We probably approached it a little differently than many of our market participants by crawling around in Canada, Thomas and I, until we found the right cultivation. Northern Green Canada was our very first supplier. Why did we choose them? Well, as I said, we really looked at dozens in Canada, and then we actually made sure to find a service provider who could achieve the quality, but who is also capable, with our help, of obtaining all the necessary qualifications through a German authority. We found a kindred spirit with the owner the founder of Northern Green Canada, Lisa, it clicked right away.
My name is Lisa McCormack. I'm the CEO of Northern Green Canada. We started Northern Green in 2014 is when we first registered the company. We built out the facility. The facility is 90,000 square feet. We have 10 EU GMP dry rooms, 7 grow rooms. And in March of 2020, we received our EU GMP certification.
You have to imagine there is no collateral in this area, and they wanted a whole lot of money first. It's called a deposit, so that they could start working with us. And because the spirit, the exchange, worked so well, Thomas and I decided, without further ado, to invest a very, very large sum of private money, because no bank would have simply built it for us, i.e. 0 guarantees. It was simply a good fit from a human point of view, because they simply follow exactly the same approach as us. Namely, they simply want to be better in the medical cannabis sector. They want to deliver better quality.
What differentiates Northern Green from other licensed producers in Canada is we haven't participated in the domestic market. We have always been about the medical cannabis. Therefore, things like growing stable genetics, educating our team on how to grow that genetic, and them learning through their experiences with that genetic and how it grows, and the ability to react in those different phases of growth. Our team of growers here understand that and understand the genetic, and it has produced the highest quality cannabis.
I am Jan of 420 Pharma. I am the head of cultivation. I look after our suppliers, which means everything from cultivation to drying to further processing before the product comes to us. I have worked a lot in America, Australia and Canada, and am currently traveling mainly for pharma in Canada. In addition to NGC, we have another partner near Toronto, an external supplier that grows medical cannabis in a greenhouse. Cultivation takes place under JSCP conditions, which means good agricultural and collection practices. Nevertheless, there are very strict safety regulations here, and we also have hygiene measures that we have to comply with. We are here in the section where the mother plants are, and this is where the cuttings are cut. In the production of medical cannabis, it is very important that the plants are genetically identical. That is why we work with cuttings and not with seeds. In principle, seeds are like siblings in that they are sometimes a little different, and we naturally want to have a product that is very uniform and simply has constant values for the patients. It is very important here in the room that the humidity is right, the temperature of course. And here we have a light cycle of 18 hours. 18 hours of light on, 6 hours of light off, that keeps the plant growing. Later, when we are in flowering, the plant only has 12 hours of light and 12 hours of darkness, and this basically triggers the flowering phase. So the mother plants are simply the basis, that's where it all starts. We go in here with 100%, the plants just have to be really healthy. If we now had a mother plant that was only at 80%, this would simply continue throughout the whole process. This means that it is really important to us that the mother plants are tip-top, that we start with 100%, and that we are simply not satisfied with anything less. The cuttings we currently have here now were rooted in the small blocks for a period of approximately 2 weeks, and then placed in the larger blocks. You can already see the rooting at the bottom, and then they go into the larger slabs where they are placed and where the drip irrigation begins. They stay here until the harvest. We work with plants here. Pests love plants, and they also like the climate we have here. However, we don't want to work with chemicals, which means we work with beneficial insects that hunt and control the pests naturally. So here we are now in the third week of flowering, and what is happening to the plants now is that some leaves are being removed, especially on the underside, so that the air circulation is good. You can see that the first inflorescences have already formed here, and if you look very closely, you can already see the first trichomes forming. Of course, that's what will be the active ingredient for the medicine in the end. What we also do in the next step is put a net around the plants, which gives the plants support for the next few weeks, and they still have about 5 weeks of flowering. Because the flowers that are growing here now will also become heavier over time, and the plant may not be able to hold them all. Of course, we definitely want the plant to have safety and security for the final phase of its life. Absolutely. Here we are now in the middle of the 5th week of flowering. We still have about 3 weeks until harvest. You can see that the flowers are really gaining in volume and weight too. That means the net that you have stretched, that is really necessary. What happens here every week now is that we scout for pests or other factors that can influence quality. And this is of course essential in the production of medical cannabis. So when we visit external growers, we take a look at the entire plant and all the processes. Of course, it is very important that they comply with all regulations, that they adhere to all hygiene regulations, because that is of course the greatest risk. We don't want any bacteria or mold infections in the plant. Is there regular testing for diseases? Do we also have proof that they are healthy? And of course, the most important thing is that we take a very close look at the plants to see whether there are any pests in them, whether we see any signs of disease in the plants. Irrigation is automatic, and various fertilizer solutions are used that are specially formulated for the growth or flowering phase. We can see from the plant that it is really mature because in the final stage the plants are harvested at the right time, which the genetics need. This means that they are not harvested too early, not too late, and we simply have the highest possible active ingredient content of cannabinoids, terpenes, flavonoids, and other aromatic substances in the plant. When we work with external growers, the cultivation takes place there. For further processing, however, the product is taken directly to an EU GMP certified facility after harvesting, and this takes place under controlled conditions. We work with a refrigerated transporter where the humidity and temperature can be controlled and documented. You can think of it like the cold chain for food. So when I arrive at NGC or other suppliers, we first discuss what has happened in the last few weeks or months, depending on how long the last visit was. We look at the data for certain badges to double check that everything is as we want it to be. When we go into the cultivation rooms, we first have to make sure that all jewelry is removed, so you can't wear any rings or watches. The first thing we have to do is wash our hands, and then we have to follow all the steps on how to get changed. So we take precautionary measures to ensure safety and cleanliness. These include hair nets, bath nets, a complete coverall, and gloves. This is done to really minimize all possible risks of bringing any contamination into the cultivation rooms. When we move from the cultivation area to the processing area, we transition from the GACP to the GMP area, and there are entirely different regulations. So, we put on a clean coat, new gloves are worn, and shoe covers are put on again to ensure that no contamination from the cultivation area is brought into the processing area, to ensure complete cleanliness and hygiene. Similar to external suppliers, we at NGC also in fact have our own mother plants for production. Of course, we have completely controllable conditions here, which is of course possible indoors compared to a greenhouse in the mother plant room. There we cut the cuttings from the mother plants, then prune them again and cut off the leaves. This has to do with the fact that in the domes, where they come in later in these small greenhouses, there is simply less or better air circulation so that the plants don't dry out so quickly. And we dip the plants in a liquid, which is a cloning gel that stimulates root growth, and then they are put into the medium, which in this case is rock wool, and they will remain there for 2 weeks until they have taken root. The cuttings are also placed in paths where these small greenhouses, these domes, are located. And the light intensity of the cuttings plays a major role in that it is not so high, because the plant is not supposed to reproduce leaf mass, but to form roots. It needs less light for this, which is why we have these neon tubes or LEDs for the most part. For the cuttings, it is extremely important that they have sufficiently high humidity, because the plant cannot yet absorb the necessary moisture, the water, through the roots, but only through the leaves. And that's why in the room, even if there are small individual greenhouses over the cuttings, the overall humidity in the room is still increased to ensure that the cuttings can perform well and thrive. So before the cuttings go into the rooms, after they have rooted, we prepare the rock wool blocks in which the rooted cuttings are then placed. The blocks are rinsed once with osmosis water, which means that the water is completely clean and sterile after everything has been filtered out. And then they are loaded with a nutrient solution so that the plants, the cuttings that come in, are already in a medium that contains a nutrient solution, and the roots can then develop from the small block into the large block. The next morning we put the cuttings in the blocks, and we have about 600 to 700 plants per room depending on the variety. After the cuttings have been inserted, we remain in the growth phase for about a week, i.e. with 18 hours of light. We have 1000 watt sodium vapor lamps in the rooms, and they have exactly the right spectrum that the plant needs for the flowering phase. The flowering phase is initiated by switching the light cycle to 12 hours of light and 12 hours of darkness. In the year 2001, the flowering phase, which is a crucial stage in its development, typically lasts about 8 to 10 weeks. This duration can vary significantly depending on the specific genetics of the plant. During these 8 to 10 weeks, many checks are of course carried out. We regularly check the draining water from the nutrient solution, and of course we check the temperature and humidity in the room. We remove leaves where necessary to create the flower structure we want. So of course there are a lot of steps that take place in between, and then the plants are ready for harvest after around 8 to 10 weeks. When we harvest the plants, we start by removing the nets that have held the plant in place. And then we cut the plant whole if possible, so that it can be hung up whole. The plants are packed into large containers which are also lined with plastic. When the container is full, it is moved out of the flower room, goes directly onto a scale, and the weight is documented immediately. After weighing, the container is taken through the material lock. the material lock connects the GACP area, the cultivation area, with the GMP area, the further processing area. Here we have a material lock where only the container is really pushed in, which is then pulled out by the post-harvest processing team. However, the people go through a personnel airlock. This allows us to ensure that no contamination is carried into the processing area by the harvesting team. The drying room is, of course, thoroughly and completely cleaned, down to the smallest detail, and absolutely disinfected, ensuring that when the goods are brought back in for drying, there is no risk of any contamination reaching the plants. The plant is hung up whole for drying, so we also try to cut it off whole in order to, if possible, as much as possible. By hanging the plant as a whole, we can ensure that the overall drying process takes place slowly and gently. Through slow and very gentle drying, we can ensure that as many important aromatic substances and active ingredients as possible are preserved. One flower room also fills exactly one drying room, which means that a batch is completely in the same room. When the room is full, you can see that the entire ceiling is full of plants, but there are also extra areas where plants are hung. Sometimes you can also see individual branches hanging on them. This is simply because when you harvest the plant, the shoots sometimes grow through the net, and you then have to cut off individual shoots. However, as I said, we try to hang the plants as a whole. In the drying room, we have very strictly controlled conditions in terms of humidity and temperature, and the air circulation is extremely filtered. This means that the air that comes in and comes into contact with the plants is really sterile. The optimum time to end the drying process is not fixed. It varies greatly depending on the variety. And we determine the time on the basis of measurements. This means that we measure the residual moisture in the material, but also the water activity. This allows us to determine whether or not microbial growth can still take place in the plant material. And of course, we want to ensure that microbial growth can no longer take place. When the optimum time has been reached, further processing takes place. Further processing means that the flowers are first separated from the stems and branches, and then the individual flowers are carefully hand-trimmed. This means that the leaf material still around the flowers is manually removed with scissors. This is also another processing method that is extremely gentle and delicate on the flowers and carefully preserves as much active ingredient and as many natural aromatic substances and properties in the flowers as possible. After the manual trimming, the flowers are packaged. Everything is of course weighed to the exact gram and then sealed with a light vacuum. The goods are now ready for shipping and are stored temporarily until they are actually shipped. Of course, this entire process also takes place under controlled conditions. While the goods are waiting in the warehouse for shipment, samples are taken and analyzed in the lab. Once the goods are cleared for shipment and we have all the export documents, the pallet is packed. Additionally, we also use so-called data loggers that document every step from packing to the goods arriving at our warehouse carefully. This means that when we receive the goods, we can read these data loggers and see whether there were any conditions that had a negative impact on the goods.
Hi, I'm Philip. I'm the head of quality control here at 420 Pharma and also head of the laboratory, the analytics laboratory. We received the goods from Canada. This is the so-called bulk batch, meaning the bulk material, and it is initially inspected carefully and thoroughly for quality here in our lab. We carefully prepare the sample for content determination, which means we first grind the flowers into a fine powder and then we extract it with ethanol with alcohol. And then the ingredients, the active substances, essentially and ultimately the cannabinoids, transfer into this liquid phase, that is basically into the alcohol, and this is ultimately our sample that we use for the analysis. This is the green liquid that you see right there. We also determine the drying loss of the cannabis flowers, which means the residual moisture content. This ground sample is then placed on a small aluminum tray and then in a drying cabinet. The sample is dried there, and then we weigh it before and after. And from the mass difference, we then know how much moisture was present in the sample itself. Then, if the bulk goods meet the requirements, they can be released for production here in Germany, here at 420 Pharma. That would then be the next step that happens with the goods.
I am Pia Timmermann. I have been in charge of production at 420 Pharma for 3 years now, and we are currently in the first production room. In our Space Class E, we pack the bulk containers that we receive from Canada in 5 1,500 and 400 grams. Each flower is handpicked by us, so we really inspect every flower again to see if it needs to be trimmed again, and then they end up in the packaging, which we then use in the pharmacy. Safety and accuracy are our top priorities. That's why everything is documented and thoroughly double-checked, carefully.
Der Bundesrat hat heute trotz aller Vorbehalte zugestimmt, Cannabis teilweise zu legalisieren. Damit kann das umstrittene Gesetz zum 1. April in Kraft treten. Es erlaubt Volljährigen, die Droge unter Auflagen für den Eigenkonsum zu besitzen und anzubauen. Gesundheitsminister Lauterbach sprach von einer richtungsweisenden Entscheidung.
Doctors were already allowed to prescribe it before. However, since it is no longer classified as a narcotic, the hurdles have suddenly been lowered a little. So the doctors suddenly say, wow, I'm now suddenly dealing with this topic because again, there's this issue of German bureaucracy. Of course, somewhere, yes, I have to report it to an authority, to the Federal Opium Agency or BfArM for short, and maybe I'll lose my license to practice medicine. None of it is true. Interestingly, this decision leads to many doctors allowed to prescribe it, suddenly wanting to engage with the topic and do so. They wanted to before, but always said, I won't do it while these hurdles are still there.
We are now, so to speak, a bit behind experiential medicine with our research. This is a situation we have never had in this way before. And because there is evidence that cannabis medicines are effective in so many different indications, it is truly a Herculean task. This means that we need a large number of studies in many different indications. These studies must all be carried out with a good design. These studies need large numbers of cases in order to actually prove that cannabis medications are effective. I think we need to pay less attention to safety because we have a lot of data showing that cannabis medications are sufficiently safe.
It just belongs there to be prescribed as a normal medication. Sometimes it's ridiculous in my eyes when I can prescribe a patient 150 pentanol patches, after which he stops breathing 2 hours later and nobody says anything.
An important point that should be noted that cannabinoids in medical use and cannabis as a recreational intoxicant are just as different as morphine as a painkiller and heroin as a drug. And especially on the topic of cannabis, there are an incredible number of mix-ups happening here. The problem is that there is simply no clear differentiation between recreational use, stimulants, intoxicants, and medical use. And I believe that many colleagues still do not fully realize the importance of cannabinoids in real medical care for people with serious problems. With morphine, it is clear to everyone that it is indispensable. With cannabis, we still need to do a bit more educational work.
My primary background is in internal medicine. I worked in oncology at the university hospital for a long time, and then, almost by chance, started holding consultations on the topic of medical cannabis. I saw that there is still a huge need for education on the subject and that it helped many patients.
For me, it was such that my thinking essentially shifted from a surgical mindset to a more essentially biochemical way of thinking, which meant that I could say quite clearly that I see people every month, every few weeks. What is great is that you talk to the people and you exchange ideas with them, but you also really experience firsthand how incredibly good it is for these people.
Chronic pain patients have a long history of suffering. They have already tried numerous medications and different therapies. Many of these have often not worked, and then we come with the cannabis proposal or therapy attempt. And if that works well in this particular case, both the patient and the practitioner are satisfied overall.
We are struggling a bit in the cannabis scene with this recreational market. That is actually the main hurdle, as we are always being put into a certain category, and we need to get out of that. And it has become somewhat of a passion. I have always been involved with it, found it exciting, and through the whole lecture system that we have, where we deal with the topic, also giving talks for companies and having many patient contacts, you get, I believe, a pretty good sense of who is suitable for it and who is not, and where you need to be a bit careful.
In the beginning, of course, the topic of cannabis was viewed a bit differently by the older generation, and perhaps even somewhat stigmatized due to the cultural and societal norms which often painted cannabis in a negative light. But when you really get in touch with the patients and really listen to the therapy successes and truly see what has actually been achieved through this possibility, then you fully stand behind it and simply say it is indeed a therapy option that should actually be offered to every doctor. And if you are fully treated, maybe you should actually fall back on such things.
My name is Philip Hoffman. I am a pharmacist from Paderborn. This pharmacy specializes in medical cannabis. We are operating online under the name 420 Broccoli. There is a huge selection of medical cannabis, and it is very difficult to decide in advance which strains to keep in stock. And 420 Pharma really set a standard there because they indeed focused on quality very early on. This quality, the gold standard as they call it, really is just that indeed. They were the first to start focusing on high-quality medical cannabis, and that quickly made them a big name. And so it was immediately clear to us that we also had to have the products. The demand has exploded. This means that many patients or even doctors who were previously unsure have taken the plunge and are trying out cannabis in prescriptions. And that leads to a huge rush for us, a massive demand that we can hardly keep up with.
So what did we do beforehand? Naturally, in anticipation of this being legalized, we restructured the areas a bit. We have established a new department, which we have called medical. We even hired someone specifically for this role, whose sole job is to be out on the street, so to speak, engaging with key influencers such as doctors, pain clinics, nursing homes, and care home operators. The goal is to really bring the topic to their attention, what I like to call door-to-door promotion, and encourage them to get involved.
Yes, indeed, my name is Tino Haag, and I currently head the medical division at 420 Pharma. Together with my experienced team, we are the point of contact for physicians who have many years of experience in the field of cannabis therapy, or who are new to cannabis therapy and want to gain experience and work with it in the future. This can be the general practitioner, but also various care centers, different medical care centers, clinics, hospitals, and other healthcare facilities such as nursing homes. Then the topic of palliative care services, specifically SAPV, specialized outpatient palliative care, continues to gain momentum. And yes, we take care of all these various target groups together with my dedicated and hardworking team. A very important component in this context is the topic of training and further education. There are many doctors who have had experience in the field of medical cannabis for several years, and also have experience with the various forms of administration such as flowers, but also full-spectrum cannabis extracts. However, we also notice that the topic of exchange is very frequently requested because they often need to discuss with other colleagues how they handle and implement the topic of cannabis therapy in practice. Subsequently, we also established the Circle of Experts, where various specialists in Germany, who already have extensive experience in the field of cannabis, exchange ideas on the topics and highlight the successes achieved, because the successes are really very numerous out there, and we are now gradually making many of them visible as well. Indeed. A very important component is the 420 Academy, where we offer training and further education opportunities both online and in person in various formats to cater to different learning preferences and schedules, ensuring accessibility and flexibility. Furthermore, we have been represented at various numerous congresses, symposiums, trade fairs, and other important promotional events. A very colorful bouquet, and we are basically trying to have the right offer in the portfolio for everyone, to reach as many people out there as possible, and to win and excite them for cannabis therapy.
Then, of course, we have what we must never lose sight of, which is simply our target audience as well. Ultimately, in essence, there is also the patient consumer, which is where we started, in fact. We did this for them, after all. We said we want to achieve the best possible quality in this tough environment, meaning strict pharmaceutical regulations and stringent limits to get the best material on the market.
Another important part of my job at 420 Pharma is to regularly attend the patient advisory board meetings, which are crucial. And of course, the whole purpose is to get direct and honest feedback from the patients about our products. And we can then integrate that back into production and also into new breeding, into considering what is still needed in the market and what patients require.
I don't need to take ibuprofen or Novalgin, they don't actually work. So I have headaches and they don't help me. And there, cannabis has definitely, in my experience, undoubtedly helped me the most so far.
Well, it was really a bit of a shock at first because it's not your everyday typical medication. I think it was a bigger shock for my parents than for me. Yes, at first you think, yeah, that's a junkie, she smokes in the evening or all day, stays home all day. You can't do anything with her. But that's just not true. I can drive a car normally, I go to school normally, I go to work normally, so everything worked fine.
Yes, conventional medicine and therapies didn't help me, and I am glad I have been a cannabis patient for 3 years. I am now standing on both feet, beaming with joy, and can truly enjoy life again. So for me, this has truly brought back an incredible amount of zest for life and indeed joy.
I was already familiar with cannabis as a drug, of course, and its various properties. It was quite relatively interesting for me to find out how it differs from the illegal variant.
So many problems with the gastrointestinal tract eventually. And with cannabis, it's just that I can tolerate it much, much better, honestly. I never had the prejudice that I wouldn't choose this path because especially when you're sick, you first go through a marathon of various doctors and have already been through a lot of medications and treatments. And yes, I was always definitely open to trying new things and just seeing and interacting and engaging with them to see, okay, how does this make me feel and how does it help me?
Well, it definitely does me good indeed. We can say with absolute certainty that these are the medications that relieve the pain the most.
Socially, it's still a bit difficult. You are, of course, always labeled as the ultimate stoner. And it's assumed that you only care about consumption and not the medical aspects. This is still not well received in our city. Even with the vaporizer, consuming outside is not welcomed. Therefore, as a patient, you still have to hide to be able to take your medicine.
And I simply wish that, as Thomas Chatton, I could stand somewhere and, if my body requires it, partake in the use of cannabis without being looked at strangely, or people thinking anything else about me. I hope that in 1 or 2 years it will be a bit better, because this is also my personal opinion. The world will be a bit more relaxed and at least not worse because of it.
For the future, I can definitely imagine expanding this area of breeding our own strains and crossing our own genetics even further, with a focus on exploring new possibilities in the field of genetics to enhance our breeding techniques, because I think a real difference can be made there. This is naturally an area that definitely primarily costs money and where many companies do not want to invest. But I think with 420 Pharma, we have a team that is also very progressive and forward-thinking, so that we can further expand the area, and patients might not have to try 20 or 30 different products before finding the right strain that helps them. That's definitely something I can envision, where we are definitely headed.
My name is Wilhelm Schoening. I am one of the founders of Pharma, and I take care of the finances here, which are currently changing significantly because we are, of course, growing larger. So we are now 75 employees, and we have grown significantly in terms of revenue over the past few years, year after year. And because we belong to a large group, Curaleaf, an US corporation, which naturally have certain expectations and requirements regarding reporting and accounting, certain demands naturally arise in all these areas. So the more visible we become through success, the bigger the rules become, or rather the stronger and stricter the rules become.
Thomas and I, and of course our other partners, we always thought, how should we build this? We simply don't want to pretend. We are the Paderborn guys.
I can come up with all sorts of strange methods and who knows what else, and write it all down on paper and flip charts and whatnot. Or I can just say a straightforward sentence, go get a roll now, and the result is definitely the same. One way takes me a week to get this roll, while the other way takes 20 seconds without much hassle, and easily. That's why we decided to do it just like at home. It's like a mini company, in essence. You don't talk to the kids about what the KPIs are that we need to agree on and have a meeting first. Instead, it's about eating up, putting things away, getting up, and cleaning up. Very simple, very straightforward, but with mutual respect. I always try to explain to employees they can do the same to me. If I leave something lying around, they should tell me, Thomas, take the collar away now, because I want to learn that too. Sometimes I don't notice it, and it's just a very human approach to management that in fact works just as well as the more role-based styles, I would say. Indeed. It does wonders for my soul and my body too, because it keeps you incredibly fit. You can generally use instruments as a form of exercise. This is no joke, because it involves a lot of muscular activities and movements. If you perform it with the right intensity, then it is indeed a sport, indeed. So you really burn a lot of calories, and that's definitely the main thing for me. Of course, there are also the really nice feelings you get from it. I'm always very happy when I'm playing the piano, but I'm also happy when I'm doing other things.
We motivate each other together, of course. It's not like we think we have to move mountains here. We motivate and encourage each other to get a little bit better, to give a little bit more, and we have fun doing it. And we enjoy it. I think the point is that you can be absolutely and completely relaxed. I can just be who I am and do what I feel like doing.
For the past 2 years, the ice bath has really been the ultimate game changer for me. And the moment I started ice bathing, I realized, wow, it's like a time travel. I feel like I'm in my early 20s again. I'm totally energized. People always think I've taken who knows what, but I always say I haven't taken anything at all. It's just sports and ice baths, and no idea, it is so good for my body.
And I found, to be honest, actually it was really okay. It was acceptable, because when you go in slowly, which I have tried 5 times with you already, I always got to a certain body part, then it got small. Yes. And I have to say, I felt really good afterwards. Yes, that's true. It is very important to us that we deal with each other in a family-like way in the company. Flat or no hierarchy at all. Of course, there are two chiefs who have to make the decisions at the front, that's clear. But otherwise, the heart should be on the tongue. My motto here is always personal, no fun without enjoyment. And that's how it's lived out.
I am Alexander Gorka, and I have been proudly working with 420 Pharma since the year 2022. I am responsible for overseeing sales, or as it's more commonly referred to in modern terms, the head of sales department. We all, when we are in the cannabis industry, have this career-changing profile in the cannabis industry, and I definitely believe that this is not wrong at all. Rather, it simply helps the market. My professional background is in the insurance industry. That is certainly indeed as far from the topic of medical cannabis as the Earth is from Mars. But there are so many synergy effects, and I can recommend to anyone who wants to get closer to this industry or who want to get a bit closer to this field, I can only recommend taking the step. I haven't regretted it to this day. Indeed.
Working in a quality control lab is, on one hand, very demanding, but on the other hand, extremely varied and interesting, because many different tests and procedures take place, and yes, in the case of 420 Pharma, the samples in this particular case are cannabis. This is, of course, an especially exciting environment, as it has become a bigger and increasingly important topic in the medical field over the past.
In the medical field, there are various responsibilities and tasks to handle. This makes the job very diverse and interesting. From a personal perspective, because you can help patients here and because you have a completely different motivation and you see a result and get direct feedback from patients. That was, yes, it's a great feeling.
Yes, it's just really fun because you can absolutely bring together the enjoyable with the advantageous, and that gives me a new drive indeed every single morning, and it's incredibly fun every day to be out there again, helping people either discover cannabis therapy as a form of treatment for themselves or pass on the therapy to patients and just give them simple compassion that certainly helps them.
I am not at home as frequently anymore, but that's completely fine because I can simply do what my passion is, and that is the plant. And to ensure that a reasonable product, not only from a pharmaceutical perspective, but also from my perspective as a cannabis enthusiast, gets to where it is needed and appreciated by those who require it and can make the most impact. So that is truly never-ending and incredible satisfaction for me, and it absolutely gives me a lot. And that's why I truly love the job I do, and I can proudly say that I wake up each and every day excited to work and to do what I do.
It makes me very satisfied and also very happy because here you are not only earning money, but you are also doing something truly meaningful by helping people. There are really people, and I have personally had the chance to speak with some who have already attempted suicide several times or have thought about it, and have truly found a way to a life worth living again through cannabis. And these are simply fates. That makes one extremely happy. And it also gives back a lot of energy, because there are definitely other industries where I would say you just don't get as much positive energy back from people. And here it is a very special industry, also a very crazy industry, but the energy you get from it and the good you achieve simply gives you the courage to keep going.